So this treatment here is going to involve what we refer to as lateral epicondylitis or tennis elbow. So pain is generally felt on the outside of the elbow, typically in this region here. And what we're going to do is we're going to use our laser in order to reduce inflammation. We're also going to use our laser to help increase blood flow and promote healing in the area. And I like using the LightForce FXI to help me with that. And it's very simple. The way we do this is we go to protocols and we use the influence technology that's built into this technology here, and we select the patient's height, body type, and even color, skin color. And once we've selected that, we go to next, and then we select the area of the body that we're going to be working on. So we're going to be working on the elbow, and we're going to go into an epicondylitis. There's a tab for that. So the treatment is now very specific. Not only is it specific, it's very consistent, because each time the patient comes in, we can lock those treatment protocols into the device, and we can utilize a consistent treatment each time the patient comes in, and we're able to track the progress a lot better that way, I think. So once we've put those parameters in, we've now determined that the treatment's going to last about 6 minutes. We're going to use about 10 watts of power at a continuous watt pulse rate. And we're going to go ahead and hit standby and let that beep 6 times. I like using the smaller applicator that's got a round ball on the end so that we can make a contact on the patient. And once we're ready to start the treatment, I make contact in the area. And the beauty of this is that not only am I providing the laser treatment, but I'm also depressing the tissue, pushing out fluid deep in that area to allow for that laser to take a little bit better. It's a specific way to deliver the laser treatment. Not only that, depressing the tissue does provide some therapeutic components to the patient, provide some relief. What the patient's going to feel is a warming sensation in that area. And typical treatment for this area is going to be about 6 minutes, depending on if the patient's acute or chronic. If the patient's chronic, we may increase the power on the machine. We may also increase the length of time that the treatment takes place. So we do this first part of the treatment with the patient static, the patient still. And after the treatment's concluded, this part of the treatment's concluded, then I want to have the patient go into some motion. I want the patient to recruit these muscles. I want the patients to move the joint a little bit. So then what I'll do is I'll have the patient, in this case, hold on to the flex bar. Go ahead and hold that there with that left hand, and go ahead and bring that flex bar to tension and stop right there. Now, what I would like for you to do is I'd like for you to go ahead and bring that wrist down. Do that for me 10 times. We're going to recruit these muscles around the joint here. Okay, and go ahead and stop, and go ahead and start again, and we're going to recruit those muscles, and I'm going to laser right here, right where the site of pain is, as the patient is recruiting those muscles, and as the patient is moving that joint.